Hey, welcome everyone. I think we now have both our speakers and it's a couple minutes past the hour from what I'm seeing. So we'll go ahead and kick things off. You should be seeing our first speaker, her screen here. And just to orient everyone, we're here for actually a regularly scheduled webinar series between Environment Canada, or Environment Climate Change Canada and National Weather Service. So our agencies have been collaborating for years now, and one of our main events is actually this webinar series. So a couple times a year we host webinar series, typically on extreme temperatures and their impacts. So this round we're going to be focusing mainly on heat, and we do have a change in our schedule here. So you'll see here Armelle Castell, who is a warning preparedness meteorologist. He was actually going to be doing this presentation, but had to last minute step away. But we have a wonderful replacement for him. And so we have Melissa McDonald here from Meteorological Service of Canada and ECCC to present on his behalf and represent for this presentation on the British Columbia heat dome. So I will go ahead and pass things over to Melissa, and then once you're complete, I'll send things over to Dr. Sarah Henderson and introduce you as well. So Melissa, I'm happy to pass it over to you.
Thank you very much, Danielle. I'm happy to be here, and unfortunately I do not think I will do this presentation the same justice that Armelle would have, but I will give it a shot. I was involved in Armelle originally developing this presentation for the EMS annual meeting, but I definitely am not up to speed, and it's been a very quick replacement, so letting y'all know. All right, so the BC heat dome, as Danielle already explained, is the topic of today. I know this presentation does cover a little bit farther than that, so as you can see right now, Armelle already made a few updates to the presentation for me, and he mentions here from the deadliest weather event in Canada's history to the most coldly inside 5 months. So it's going to be a little overview of an awful lot of what happened in BC and Western Canada throughout last summer straight into just first, I know Armelle really wanted to acknowledge the hard work that was done for all these events out of climate services locally and nationally. Of course, warning preparedness meteorologists like himself and the decision support meteorologist on the desk, but also the Pacific Storm Prediction Center. Their operations 24/7 wouldn't have made heat warnings and everything happen last summer without them. And then, of course, our partner organization of Health and Emergency Management in BC. All right, so a timeline of the BC events, the flooding, and just so that, you know, we've talked about all of 2021 here, and right starting in June 2021, things did not let off. We started in right around just before the July 1st period with our heat waves, extreme heat, that led in directly into wildfires associated with the heat and drought at the same time. Of course, there were more quality events at the same time due to wildfires. And you note here that, you know, we had to, the BC provincial had to call, province of BC had to call a state of emergency. And then there was a request for federal assistance throughout the period of the summer into September due to those wildfires. And then of course the following of the heat. There was then following into the fall, what are the normal conditions? There was hurricane forced winds, extreme rainfalls, floods, mudslides. And the mudslides weren't even attributed by just from 3 days of rain. It was solely an entire season of what are the normal conditions. And then once again, we point out here in during the rainfall mudslide flood situation, that once again we had to, there was a provincial state of emergency called by the province. Oh, fast, guys. All right. So this is just an animation that shows those cascading hazards and their impacts across British Columbia, and then of course up in the northern portions of Yukon Territory. Oh, running as expected. Oh, here we go. I think it's just to zoom in here to sort of show you where everything is located. So here we are, British Columbia, Yukon Territory to the north. Alberta itself was definitely affected by the heat, as was the rest of Western Canada, right through the prairies and wildfire smoke. And then if I click further, we can see where the drought conditions existed. There we are. I'm not quite sure how the slides operate. Apologies, folks. And then we had the heat wave cover the majority of BC and Alberta itself. And then, of course, flooding in the north, the fire associated under the heat wave, and generally normal conditions in BC, unfortunately to say. And then following that with the air quality events that streamed right across Canada, actually even making it straight through into the eastern regions eventually. And then once again into the fall, flood again. So it was quite an extreme season for BC. So particularly noteworthy of the upper ridge was that the air mass aloft. So this is just an example of how my apologies, of how a heat dome sets up. And in this case, particularly of noteworthy was the upper ridge of air mass that was aloft of British Columbia and northern Washington state. There was warming such that anywhere in North America at the 500 millibar level heights, we could exceed 595 decameters, which are, sorry, 595 millibars, which is just extreme, rare to exceed anything above 600 anywhere in North America, even into the southern US. So an example of just how extreme this heat was and the blocking pattern associated with that heat dome. This is an image that was taken, if I recall, from geographyreal.com, and it is a satellite imagery that shows what the 2-meter air temperature was right across the region. You can see these really, really dark red areas are, I mean, greater than 20 degrees Celsius, but I'm sure that we saw temperatures up to almost 50 degrees Celsius. So the scale isn't very appropriate here. Let me see what notes Armelle provided here, saying that the meteorological pattern wasn't just a big event because the national daily maximum temperatures were broken. It wasn't just one maximum temperature, it was about 4 weeks of, about a whole week of record-breaking temperatures. And this started approximately 4 weeks beforehand. We were starting to already see early season events related to heat across the province. So here's just a demonstration of what the difference was in terms of what our normals are, or associated percentiles of temperature right across the province and area. So this is just in June. We could see how far above normal the temperatures were in degrees. We saw that Alberta was really quite warm throughout the season, as was BC and southern portions as well. We move into the summer period as a whole and see just how above average the whole southern region of BC was. And then this one is comparing the precipitation that was seen throughout the summer. I'm pretty sure that's precipitation, but unfortunately, I don't have any key that tells me either way. Here we go. But actually, no, I'm starting to think that, yes, it is definitely precipitation. Yeah, yeah. So this is just showing the percent normal summer precipitation. Right. And then just by how much was the temperature actually exceeded, daytime maximum temperatures exceeded right across the region. So this is a scale that's showing just the the magnitude, how much magnitude greater than the regular average daily temperatures were expected. So all-time max temperatures for June 25th through to July 3rd, 2021 is what this covers. And then it's taken from the maximum record value that ever existed before. So the magnitudes of how much the actual temperature exceeded and broke the record was quite extreme. So up to 7 degrees, but in many cases, all these big red dots. You can see here too, in Victoria, which reached 39.4 degrees Celsius down here on June 28th. And that is really extreme for this region to start seeing value in that area. Vancouver saw 4 straight days above 30 degrees Celsius. This is unheard of. When we developed our health-based heat warning criteria, I would have said that was insane. And then another highlight that Armelle has here is about the Burnaby station having an overnight temperature of 29 degrees Celsius. So absolutely no respite and no relief from heat overnight. And so that unprecedented heat led to fires, of course. So just an example, Lytton, BC, unfortunately, the town of Lytton, BC was devastated by an extreme wildfire that started on June 29th. And these are the maximum temperatures daily that we're seeing up until that event, reaching into the high 40s. The original record had been 45 degrees for Lytton, and that was from 1937. So it's an all-time Canadian record, broke 3 days in a row. And so, of course, you know, this all leads to human impacts for sure. In early summer 2021, the province of BC experienced the unprecedented heat dome, of course. Rapid attribution analyses found that this historic event would have been virtually impossible without anthropogenic climate change. Hundreds of local temperatures were broken, often on the consecutive days for the same location, as I've already mentioned. And, you know, we did mention, and I discussed already, how that occurred in Lytton, where we broke all the temperatures. And then at the end of this, you know, what were the impacts associated with it? We realized the human impacts. There was definitely infrastructure impacts, agriculture, wildfire, and then we are wildlife impacts, but and then we've already mentioned the wildfires and poor air quality associated with that. So drone at a glance, and I'm even heading more into a territory I'm not familiar with. I want to be clear as I try to present what Armelle had here for us. So I'm going to try and read from my notes that he's provided a little bit here. So Thompson, the Okanagan, and the Columbia Kootenay had the most severe droughts ongoing. So this area is more interior southern regions of BC. The province of BC evaluated the drought levels based on a report of creek flows. So we use a hydrometric network with a gauge that tracks the majority of water throughout the river systems, and usually can sort of see from that the expectation of flood and drought throughout the area. The drought monitoring was a collective effect. So you can see right here our normal 2020 year. I would say a fairly normal year in 2020. And then you can see here on the right in 2021, those kind of levels of drought being experienced right across the region. And then just gives you a better view too, this image of just how extensive that drought was across the majority of Canada, the prairie region. And this is also the, you know, the regions that we experienced many wildfires. I'm suspecting we're going to get into that in the next slides here. Yes, the next step, wildfires for sure. So I'd already mentioned about the town of Lytton. In the end, 90% of Lytton was burned to the ground due to the wildfire after that heat event. Of course, wildfire, smoke, or poor air quality events dominated the province throughout this summer, but not only this summer, it was the 4th time in the past 5 summers. And then additionally, this past summer, was the 3rd most hectares burned in the history of BC. So it just seems to be a continuing cascading impacts of fire in particular for the province. And those have a real massive effect So here, July 2021, BC wildfires damaged rail lines. There was a lot of backlog of traffic right across the province due to that, and goods, I meant to say goods, right across the province because of that. And then also following with the flooding, there was washouts on two of those major lines throughout the Fraser Canyon. That stopped all traffic for over a week. The Port of Vancouver and the whole entire lower mainland region was cut off from the rest of the province with the flooding occurrences that happened into the fall. So this is just providing, further impacts. And I just wanted to mention, we talked about drought and wildfire because a lot of this is an impact from the extreme nature of that heat. And so one of the other impacts, as I mentioned, the impacts to agriculture, the berries, and BC is a really large contributor of berry crops in the province or country. And so over half of the cherry crop was damaged in Western Canada, many of the berries right across the Pacific Northwest and in southwestern BC. They baked right on the bush before they could even be picked. I mean, it was probably the picking season right at the end of June, beginning of July. And then there was definitely fallout to aquaculture, wildlife impacts. There was huge losses to BC shellfish farmers that would be equivalent to impacts that will last for 3 to 4 years. And it wasn't necessarily due to warm water, as many would expect, because much of this ocean water would not have the ability to warm up that quickly under these conditions, but really because of the high air temperature. And then when the tide came out and the very low tides, that was really typical of this time of year. Just a cascade, once again, of impacts caused an awful lot of damage to many of those shellfish that are in the lower tidal zone. And then there was infrastructure impacts too. And I think these are some of the first cases I'm aware of direct, strong infrastructure impacts due to a heat event. You see here the buckling of the road. There was melting of power cable lines. There was windows. I saw images of windows cracked and melted in the heat. They had to, of course, this is in the middle of the pandemic, so there was an awful lot of forced closures or relocations. COVID vaccination centers. There was definitely restrictions to public transit affected. There were stories that I heard too that were related to whether or not rail lines should be used. There was concerns that where sparks might be contributing to wildfire, though I do believe many of those were found to be not true. And then we kind of move in here to talk a little bit more about the mid-November atmospheric river floods. All right, so I have a note here just to trying to get through it. The main point, yes. So the main point here is just to point out that even though there was heat, and we know that was the significant effect, it did definitely have a big role to play in how strong the atmospheric river season was, because that washout, those landslides and the coastal bands were due a lot to not only just wildfire burn scars, but also because there had been drought beforehand, and then there would have been increased melting as well as compared to what would be expected usually. This is just showing one of the images of rescue and support related to those mudslide events throughout the province. And then once again, some of aerial views of the damage to the Fraser Tank Hill, Highway 1 in Tank Hill and Fraser Canyon, which I believe is one of the major thoroughfares to get into the lower mainland. And then just an aerial shot of the coverage of how much flooding occurred right across the area. And Armelle suggested we add this in here, and I think it's just a little good quick shot to be able to explain to you a little bit about the heat warning criteria that we do have for the province. So that criteria, it's based a lot on climatology, but there was heat health analysis done by Dr. Sarah Henderson and her team to sort of establish so a health-based heat warning criteria. We look for the pattern of 2 days reaching maximum temperatures of the values you can see in Celsius here, and then an overnight low in between. And you can see that these temperatures may be more mild on the west coast, of course, and up through the northern portions, but the temperatures that are used for the heat warning criterion through the interior regions of BC are quite significant. 35 degrees Celsius 2 days in a row with an overnight temperature of 18 degrees Celsius. It is a fairly dry region, I mentioned, so that overnight low is usually not that extreme, but I do know during the heat dome events, you know, I already mentioned there was record values of 29 degrees Celsius overnight, which is terribly unusual for any of these regions. It's also I think I could point out too that, you know, we've looked at the heat warning criteria and realized that, you know, though this is a great level at which to provide advice to the public and suggest that they should be taking actions to protect themselves, and also to sort of, you know, pull in the entire public health response towards heat, that there probably is a need, or we know there is a need, to be able to distinguish between our regular one-of-the-mill heat warning events like this one, but also a more emergency level events. So we have been working with the province of BC to try and work towards a pilot, towards being able to distinguish between your run-of-the-mill heat warning and the more extreme event, to hopefully prevent some of the, to hopefully prevent many of the impacts and a lot of what you'll hear Sarah talk about in the upcoming slides. And thank yous from Armelle. And I know I have a couple, yeah, I think that is everything that I have to present. I'm sorry, I definitely did not do it justice, nor was I as prepared as I would have liked to have been. To get started here today, I only received the slides just a few minutes before the presentation. So with that, I think that it would be best if we probably wait to have questions after Dr. Henderson presents the following. And so I will stop sharing my screen and hand it back over to Danielle.
Thank you, Mel. Fascinating presentation and terrifying images. Yeah, we do have a couple questions coming in, but yeah, so we are going to go ahead and hold questions and until we can kind of go back and forth between reading those and doing raised hands. And just give me one moment here while I switch sharing over to our other presenter. Okay, so as I give Dr. Henderson a chance to switch over to her screen, I'll introduce her. So we're excited to introduce Dr. Sarah Henderson, the Scientific Director of Environmental Health at the British Columbia Centre for Disease Control. So she is going to be a wonderful follow-up to Mel's presentation. She's going to be talking about mortality impacts of the 2021 heat dome in British Columbia. So getting more into the mortality information. So it looks like I can see your presentation now. So please feel free to start when you're ready.
Okay, that's a good start. Can you hear me okay?
We can, thank you.
Perfect. Hi, everybody, and thanks for inviting me to speak with you. So yeah, I'm Sarah Henderson. I'm the Scientific Director of Environmental Health Services at the BC Centre for Disease Control, but I've been at the BC CDC for the past 12 years now, and I really started my work at the BC CDC as a junior epidemiologist on the 2009 hot weather event that we had in the Greater Vancouver area. So I've been looking at heat and mortality in British Columbia for quite a long time now, and often working closely with Melissa and others at Environment and Climate Change Canada on this issue. This slightly different version than what Melissa showed. Actually, I think the one that she showed is probably a better reflection, but what we have here is the degree of anomaly in air temperature in British Columbia across the heat dome period. I suspect that Melissa's was taken from a single day. This is a multi-day average. But either image shows you how different these temperatures were compared with what our population is used to. And it's very important to understand that these regions here experience, under most conditions, a very temperate climate. So we have gone from temperatures that are typically around 20 degrees at this time of year to temperatures that are in excess of 35 degrees over a multi-day average. So this is just, and I hope Melissa's already made the point very clear, unprecedented. And then in this hotter interior region where the population is a little bit more adapted to these hotter temperatures, again, we're talking temperatures approaching 50 degrees. So I want to talk you through a few different things that we've done related to this event so far. First, just a review of the excess mortality that was observed during this event. A first study on the neighborhood factors that were associated with mortality during the event in the Greater Vancouver area, an overall analysis of comorbidities that were associated with death during the event, and then some of where we're going in the province with respect to preparing for the next time this happens. And it's not a matter of if, it's simply a matter of when. So for those of you who don't think about population mortality on a daily basis, it's usually a pretty normal thing. It ticks along at a fairly average rate, and we generally see lowest population mortality in the summer during the kinds of months where we experience this heat dome, and then higher population mortality in the winter where there's more viruses circulating. And you can see on a day-by-day basis here, we just don't have all that much variability around the expected line. When we get to the beginning of this heat dome, we see population mortality start to increase, and anything that is colored differently from green means a statistically significant increase. And then as the heat dome progresses, we see this building of mortality in the population. And when I speak about excess mortality, I'm speaking about the statistical difference between the expected line that we have fit with a statistical model and what was actually observed on that day. And when we sum up these differences across this period, we call that the excess mortality for the heat dome event. This was, on a population weighted average, the hottest day of the heat dome, which was June 28th. You will notice that the maximum mortality occurred on June 29th. This is very typical of extreme hot weather events. The population can kind of hang in for a few days, but when this heat really starts to build, we see more and more mortality associated with it. And then the mortality impacts last until, well after the temperatures have settled down a bit. Note that I say settled down a bit, but not returned to normal. We went into this heat dome with higher than average seasonal temperatures, and we came out of it with higher than average seasonal temperatures. So even on a population weighted basis, a average temperature of 25 is pretty high for British Columbia at this time of year. So we estimated that there were 740 excess deaths during the 8-day period when we saw statistically significantly increased mortality, which was June 25th to July 2nd. This is somewhat different from the types of numbers that have been reported by the BC Coroner Service, and that's because the BC Coroner Service is doing this in a very different way. Remember, we are doing this in a purely statistical way. The BC Coroner Service is investigating deaths that have been reported to them to evaluate whether or not they were caused by extreme hot weather. Now, there were 1,503 deaths during this hottest week. 818 of them were reported to the BC Coroner Service, or 54%. That's a pretty big increase over the numbers of deaths typically reported to the Coroner Service, but still The 46% that were not reported do not have the opportunity to be called heat related because only the coroners can establish whether or not a death was accidentally due to the heat. So some folks in this group would never have the opportunity to be recognized by the coroners as a heat related death. Of these 818 that were reported in this week, the coroners found 526 to be directly caused by heat. So that's why numbers are a little bit different when you hear what the coroner service is talking about and what the BCCDC is talking about. We also picked up another 20 excess deaths from the one day in this week. Now, excess deaths by absolute numbers were greatest in those aged 85 plus, and you can see that they reduce in absolute numbers with age over decreasing ages. But it is important to note the percent increases in these groups. They're pretty equivalent. So for all groups over 50 years old, we saw almost a doubling in normal mortality over this period, particularly in the 65 to 74 age category and the 75 to 84 age category. And this is pretty consistent with what we also found back in 2009, that sort of these younger, older adults were at higher risk than the most elderly. No. Are we back to my screen now?
Yes,
Okay.
I can see the bar chart.
I'm sorry, I've never used this platform before. So relatively speaking, these folks were at higher risk. The very interesting thing and very typical of extreme hot weather is that there was some increased mortality in acute care settings, some increased mortality in long-term care, residential care settings, but the vast majority of these excess deaths occurred in the community. And this is consistent with what the coroners have reported, which is in that very hottest week where they said there were 526 deaths that were directly attributable to the hot weather. 506 of those deaths occurred within a private residence. It is a hallmark of extreme hot weather that people die in community settings, in their homes, not in hospitals, not in acute care for the most part. Sorry, we're having a very unusual thunderstorm in Vancouver right now. And if there's one thing you take away from this talk today, I want it to be that people die because it's hot inside, not because it's hot outside. And it's hot inside because it's hot outside, but people die in indoor environments. Most of us spend the vast majority of our time inside. And if the indoor environment is too hot, that is where the injury is going to occur. This is some exemplary data from the community of Abbotsford, which is in the Fraser Valley, well away from the coast, but in the greater Vancouver area. And the black line shows the temperatures measured at Abbotsford International Airport. The blue line shows a home in Abbotsford with central air conditioning, and the red line shows a home without central air conditioning. A few key features here. The home with central air conditioning is just fine. It maintains a very steady temperature across all of these days of the heat dome, regardless of how hot it got outside. The home without air conditioning had higher baseline indoor temperatures, as would be expected. And then as the heat rose day after day, the temperatures in this home also rose day after day. Now, Melissa's already pointed out overnight temperatures were very high throughout this period. And here we have a peak overnight temperature of about 24 degrees in Abbotsford. 24 degrees is a high overnight temperature, but it is a safe temperature from a human health perspective. On the other hand, when the overnight temperature is going down to 24 degrees on this day, the overnight temperature in this home is going down to about 33 degrees. So I think there's often the perception that the inside of a home will normalize to the outdoor temperature overnight. It absolutely does not do that. So these folks are, the minimum their house is going to be at this time is 33 degrees. The peak indoor temperature in this home is almost 40 degrees. We've had people reporting seeing temperatures in excess of 50 degrees on their thermostats. Remember, this occurred right at the end of June, right after the summer solstice. So we are talking about peak daylight hours. If you live in a home with single paned windows that are facing to the south or the west, you live in a greenhouse. And it's for sure likely that we would have homes that were hotter than the outdoor temperatures because of that solar heat gain through the windows. Another thing to note is that these peak indoor temperatures are occurring a few hours after the peak outdoor temperatures. This is usually around 5 p.m. in this region at this time of year. This is more like 8 or 9 p.m., so closer to the time when people are going to bed. They're going to stop drinking water the way they've maybe been doing throughout the day. And I think we'll hear from the coroners in the weeks ahead that many of the deaths actually occurred overnight. The final thing I want to point out is we've been doing a lot of talking about what safe indoor temperatures are in Canada so that we can start setting some standards around them. And after consultation with our colleagues at Environment Canada and others who've been working in this area, we have decided that anything under 26 degrees is a safe temperature for human beings, indoors or outdoors. Anything between 26 and 31 degrees might be dangerous for the very most susceptible population. And then over 31 degrees, we're talking dangerous temperatures for susceptible people. And again, those susceptible people are generally older adults. We'll talk more about chronic illnesses, living alone, and what have you. But if people are at risk from high temperatures, sustained temperatures over 31 degrees indoors are problematic. And you can see that this house was sustained at temperatures over those for 4 degrees for 4 days in a row here. So we have one paper out on this event already, which is an analysis of those deaths that occurred in the community during the heat dome. And we did this research very quickly because we needed evidence for some of those other heat events that occurred later in the summer. We are lucky in British Columbia to have excellent data at our fingertips to do this type of work. And we were able to have evidence generated within a couple of weeks of the event. In this analysis, we looked at all of the deaths that occurred in the community during the heat dome in people aged 50 plus for any underlying cause of death. And we compared them with deaths that occurred in the community in prior years around the same time of year. So we're comparing two groups of deceased people, but hoping that when we pick this typical weather comparison group, we're getting a sense of what people normally die of in the community during this time of year and trying to see how the people who died during the heat dome were different. Again, we restricted both groups to those who were age 50 plus. And when we were looking at the typical weather group, we removed deaths due to overdoses or pending or unknown causes, because many, we've been in an overdose crisis in the province for quite a while now, and many of those overdose deaths do occur in community environments. When we look at the number of heat dome deaths divided by the number of typical weather deaths in each local health area in the region, we get this map. And you see a very strong effect here in the New Westminster region, if you're familiar. If you're not familiar, the Fraser River comes along here, and then it splits and goes around Richmond. This is a south-facing hill in the Fraser River Valley, and it is also populated with a lot of older building stock, again, probably with single pane windows and with a lot of people who might be socially vulnerable to the effects of extreme hot weather. We also see, a density of increased community mortality in this region, and really spread out throughout the Fraser Valley. There's obviously a bit more of a protective effect in these coastal areas, where even in this very hot weather, that offshore breeze likely plays some protective role. We wanted to look at the effects of social and material deprivation and the effects of the urban form. And what we found in these analyses was that materially and socially deprived neighborhoods were at the highest risk, so 188% increase in risk compared with that typical weather period. And materially deprived but socially privileged areas were also at elevated risk from a statistical perspective. We looked at many different measures of the urban form. The only one that remained significant in models that also accounted for social and material deprivation was green space. And we found that lower green space within 100 meters, so a 100-meter radius of the location of death, was associated with a 28% increase in risk, even when we had accounted for social and material deprivation. So pretty clear indication that green space has a protective role to play across all socio-demographic factors. We were able to reevaluate these data with tree canopy data after publication of the paper, but I've added it in here. And we found that increasing the tree canopy coverage by 5% within a 100-meter radius decreased the risk by 9%. So, again, a pretty strong shout out for trees there and the protective effect they can have. We also looked at trees within a 30-meter radius, so a much tighter radius, and trees within a 200, 500, 1,000-meter radius. It's really 100 meters that was that sweet spot. We don't see a protective effect within 30 meters. It needs to be a little bit larger than that. The second study that we've done is to look at comorbidities associated with potentially heat-related deaths across the entire province. And in this study, these are preliminary results, and we're just finalizing these results right now, but we haven't found anything different from what I'm going to talk to you about. We looked at 678 deaths that we know the coroners are still investigating. Some of them won't be heat related in the end, but we're calling them the potentially heat related group because we know they're still under investigation with the coroners. We looked at all ages, and we compared in a very similar way these deaths to deaths that occurred in prior years around the same time of year. And we have a much bigger group of controls in this case, because we're not restricting it to people who died in the community, we're taking people who died anywhere. When we look at these potentially heat-related deaths and the other deaths that occurred during the heat dome, we do see some key differences with respect to how they use the healthcare system. The health system matrix is information that gets used to cost out the healthcare system on a yearly basis, but it can also be useful for understanding healthcare usage and access. We find that almost 5% of the potentially heat-related deaths were non-users of the healthcare system. This probably isn't because they were extremely healthy people who didn't need the healthcare system. It's more likely that they were highly socially isolated people who didn't use the healthcare system. We also have a high proportion of low users. In the low, medium, and high chronic categories, we have a relatively decent balance between these groups. The other striking difference is around severe mental illness and substance use disorder. A large proportion of the potentially heat-related deaths are in that group compared with the non-heat-related deaths during this period. We have 26 chronic disease registries that we can look at to understand the conditions that people had when they died. In these plots, the blue bar are the deaths during the typical weather, and the green bar is the deaths during the heat dome. No, yes, that's right, sorry. So anytime the green bar is higher than the blue bar, we have indication that there was a higher proportion of people in the potentially heat-related deaths that had that condition compared with the typical weather deaths. And mostly we see that the blue bar is higher than the green bar. But there are a few exceptions here. One is asthma. Not a big exception, but we do see a small difference between these groups. Diabetes is pretty well balanced between them. Depression, we see a slightly larger difference. Mood, anxiety disorders, we see a slightly larger difference. There'll be a large amount of overlap between these two groups in these analyses. Where we really see the differences are substance use disorder and schizophrenia. And when we run these analyses, we can look at each condition alone, or we can look at the effect of each condition adjusted for the other 25 conditions in the data, because lots of time people have multiple conditions and we want to adjust for those multiple comorbidities. Unsurprisingly, we see that schizophrenia is the highest risk. So we're looking at a 200% increase in risk for people who have schizophrenia compared with the typical weather deaths. When we look at substance use disorder, we see a 25% increase in risk. Depression, a 53% increase in risk. Mood and anxiety disorder goes from significant in the unadjusted models to insignificant in the adjusted models. Again, that's because there's a lot of overlap between depression and mood and anxiety disorder. And interestingly, diabetes goes from insignificant in the unadjusted models to significant in the adjusted models with a 20% increase in risk. So diabetes in and of itself, not such a risk factor. When you have diabetes and other comorbid conditions, that diabetes starts to play a role. Those are the only health conditions that we found to be associated with potentially heat-related deaths during the heat dome. I think there's, in a lot of cases, the belief that people with conditions such as cardiovascular disease will be at higher risk, and that's perfectly reasonable to assume given the amount of work that the heart has to do when trying to thermoregulate under very hot conditions. We generally found that cardiovascular disease provided a protective effect, and that's something we're going to have to do some more work to dig into. We do wonder if it potentially provided a protective effect because people on medications used to control cardiovascular conditions may do better during these types of events. Lots of work still there for us. The most protective effect that we found was for Alzheimer's disease and dementia. So here's the proportion in typical weather. Here's the proportion among the heat-related heat dome deaths. And one reason for this, we hypothesize, is that people take care of people who have dementia, and being cared for, having eyes on you, those provide protection during these types of extreme weather events. So the emerging themes that we have here, the risk factors that are clear are deprivation, both both material and social, isolation, social isolation, severe mental illness, and substance use disorder. Maybe some indicator of asthma. The protective factors that we see so far in our analyses are privilege, green space, and being cared for, potentially something related to cardiovascular therapies. So now we've had an extreme hot weather event that killed 740 people in a week. This is a disaster. Um, people always encourage me not to compare it with other big public health things that are happening, but if 740 people died of COVID in a week in the province, it would be considered a disaster. And this was a disaster, and it needs an appropriate response. So we need to start working to identify what emergency conditions are, both outdoors and indoors. Again, indoor temperatures are a huge part of this. We need to build community resilience through social connection. We need to communicate about emergency conditions effectively when they occur. And then, as Melissa was doing for us earlier, a little more thinking through the connection of the public health dots here. So Melissa showed the threshold criteria for BC that we had coming in to this summer, at which a heat warning would be issued. We identified that we need to have a second level of event. We usually have a couple of heat warnings per summer. We need to have a second level of event that indicates when the conditions are dangerous for people. And what we did was look back through our data and identified that the times we've seen these mass casualties during extreme hot weather, which was 2009 and 2021, we've seen this pattern in the data. So this day over day increase in temperatures. So through those analyses, we've delineated a heat warning, which is, the temperatures are higher than is normal for the summer, but they're holding steady, and an extreme heat emergency, which is the temperatures are higher than normal for the summer, and they're going up and up and up. Sorry. The Extreme Heat Preparedness Guide for British Columbia, I hope will be out very soon. We've put quite a lot of work into preparing this, and it really focuses on indoor temperatures and the potential risks of indoor temperatures. A lot of work in here to encourage people to evaluate whether or not they can safely stay in their environment if an extreme heat emergency is called. And again, we're using that threshold of sustained temperatures indoors over 31 degrees. If you are susceptible to the heat, you should be thinking about evacuating an environment if you see those conditions. We are really encouraging people to purchase digital thermometers and keep them nearby so that they are always aware of what the temperature is in their homes, and they can compare that with that 31-degree threshold. This is a pretty simple technology. It allows somebody who's doing a wellness check by phone to call and say, "Hey, Grandma, what's your thermometer say right now?" And we hope that, as we move towards a more resilient building stock, which will take years and years, we can use this kind of technology as a stopgap measure. Increasing social connection as a public health adaptation to extreme heat is something we've been talking about for quite a long time in our group. There's clear evidence from other places that people who are more well socially connected do better during these extreme events, and that social isolation is a killer. So how do we plan to reach out to individuals in their very hot homes the next time an event like this occurs? Who are our partners? And the BC Heat Committee is doing work to actively reach out to these partners and to help them develop strategies for improving outcomes during the next hot weather event. And Melissa's already kind of touched base on this, but this is one of my favorite and least favorite images from this event. This is the Weather Network declaring a hooray hat trick for Lytton, British Columbia, which burned to the ground the next day. This is not something to be celebrated or ogled over. This is a complete and utter climate disaster, and we need to speak about these events with that kind of language. It's this just, you know, it's not okay to be celebrating the fact that we are breaking records left, right, and center. And then finally, like kind of connecting these dots. So Melissa's already talked about the fact that, you know, this heat dome set Lytton up to be a tinderbox, and it burned almost entirely to the ground the next day. This heat dome and those wildfires set us up for an unprecedented flood season when we had the atmospheric river events in the fall. And I also want to point out that the pandemic set us up for so much death during the heat dome. We told people for 2 years to stay home. It's not safe to go out. Don't go places. Don't see people. The pandemic increased social isolation, especially amongst those who are socially isolated to begin with and amongst older people. And I am never know what effect this event might have had in the summer of 2019 rather than in the summer of 2021, but I firmly believe that it would not have killed so many people if we had not run into it at that particular point in the pandemic. So all of these things do connect together. And that's what I have for you. Thank you.